Welcome, Dr. Hannah Axelrod today. And really, these issues are of top priority for our practices right now. We've got so many questions, and we're a little bit lost. So thank you for joining us today. And we'd like to get started with just a basic overview. Dr. Axelrod, if you wouldn't mind, just letting us know where the city's at with the results of the COVID testing, how the tests are being processed, and the drive-through centers, and patients that are still worried about coming out and feeling that they're going to get exposed while they're out. What have you heard about where the city is at with the testing, current testing?
Sure, and thank you so much, Judith, Pia, and Pauline for having me join you today. So I will preface this by saying I'm an infectious disease physician at GW, and my role is in clinical medicine education in our medical school, and also research as someone who helps conduct some of the vaccine trials with which our site has been involved. I don't speak for the Department of Health in any professional capacity, so some of the issues we'll be discussing today are things my colleagues and I are working through just the same as everyone else on this call. But I would like to share some of our experiences and the most up-to-date information that we have. We've had really an unprecedented amount of working proximity and cooperation between the university, the medical practice, and the Department of Health in the past year. That said, we're keenly aware of the pressures everyone is operating under. And this is not only a DC problem or a local area problem. We have in our country public health infrastructure and the local government infrastructure that were not very robust and facing shortages even before the pandemic started. So some of the challenges we've been experiencing in terms of laboratory turnaround, limited staff, and websites that have a hard time meeting surge demands, they're really just highlighted by recent pressures, but they've been a long time coming and may not have easy solutions in the near term. So some of the things that are hopeful is the speed of testing results coming back has come a long way since earlier days in the pandemic when people would wait for days and days for results. We expect to see results come back within 3 to 5 days at this time. And that's from a mix of commercial and public health labs. For urgent situations such as admission to the hospital, we have tests that can come back same day or even within a matter of hours. And sometimes for critical decision making, we use rapid tests such as antigen tests and then confirm them by PCR tests, which are the gold standard in terms of accuracy. But in terms of day-to-day, where people can go to find out if their symptoms are due to COVID-19 or not, we still recommend the public testing sites or sites run by medical practices such as GW. The DC government website for testing does list drive-through sites as some of the options for people who may be wary about standing in line or not able to stand in line. Now, we understand not everyone has a car to go to a drive-through site. So those are all valuable options that need to continue to exist. So on coronavirus.dc.gov/testing, there are options for walk-up sites, appointment sites, and drive-through sites. And it's pretty detailed with contact numbers and websites. There are also some at-home testing options. So they can be ordered from a commercial lab or prescribed by a physician. And there's a nice section on the website explaining how those work. And I want to convey once again that anytime someone is testing, it's because there's a reasonable suspicion they might have COVID-19. So we really need to remind them to observe quarantine or isolation until those results come back, and then be thoughtful even after a negative result comes back about the kind of exposures to others that they have.
Okay, very good. Does anyone have any questions related to the testing? Because if not, I'd like to move into the vaccine registry, which is, okay. Uh, so that being said, we've got our staff, our healthcare workers that hopefully have been registered or vaccinated, but for those that really have gotten a hiccup with the system as far as registering, for instance, I had an employee that registered, had to cancel the appointment, and that person is stuck in the system now where it recognizes that they have an appointment and they won't let them reschedule now. We're also getting a lot of calls from patients that aren't either in the zip code, don't reside in the city, they haven't had any luck in their own jurisdictions. Um, they're just any questions related to that. What suggestions do you have for, getting our teams vaccinated if they haven't been already? What other workarounds have you heard? And then other suggestions for patients that are calling?
So these, unfortunately, are painful situations when there are specific issues with registration. We have been advising people not to lose hope, and when the online portal fails or leads to being stuck in limbo, to use the telephone line. And yes, there is a wait line and you will be on hold for a while, but it's worth it to connect to a human being in the Department of Health and have them find a workaround. Another option is to see if your practice or your local vaccine administration site has a standby list for vaccine doses that were thought out and prepared to be given, and then the person for whom they are intended no-shows the appointment. So there may be a way to get your staff who are maybe 1 out of 2 vaccine doses in or missed their initial appointment. We had snow days not too long ago. People who are in those unique situations, they might be able to use the standby lists to cover those gaps. And then for people who work outside the district, unfortunately, we have heard that there are difficulties in using the option for essential workers who qualify under DC rules, but not in the jurisdiction where they live. And there's no simple answer except to keep trying to register on the portal. The city is working on making the website and the registration better and more reliable, and there will be more days of opportunity to sign up for appointments as the city receives more doses of all 3 vaccines through the federal government. Unfortunately, we don't have control of the federal distribution process, and this is part of our unique status as a federal district. So any advocacy that we can engage in, for instance, through relatives that vote in other states to promote DC getting the vaccines we need, can help in the long run. In the short term, I think we're just encouraging people to keep trying, get on more than 1 vaccine distribution list or standby list if they can, because there may be better availability of Johnson & Johnson vaccine in Maryland and Virginia at least in the next few weeks than in DC.
Okay, very good. And would you be able to embellish a little bit more on the standby list again, just for those that want assistance and try to, get an employee or a patient on the standby list? How do you go about that?
So again, unfortunately, there is no centralized system for this. This kind of exists on a site-by-site basis because we really have all been finding our own way as vaccine distribution sites. So for instance, GW is a vaccination site, but only for people who registered through the DC portal were eligible due to living in DC or being a medical employee, and then get an appointment. So we have occasionally had no-shows or people who had to cancel because they got COVID-19 in the meantime or other reasons. So we've been able to find homes for those doses among people who are eligible. This is not for someone who would not otherwise be eligible, but this is for people who are waiting in line for appointments to open up, but are willing and flexible and proactive, and maybe able to help us use some of those doses that otherwise would go to waste.
Okay, very good. Uh, what have you heard as far as patients being able to request a specific uh, vaccine if they're, are wedded to the Johnson Johnson or the Moderna? Uh, is is that possible, or at this point when they get called, they could just take whatever the site is offering?
At this point in the US vaccine supply, the only reason that would be honored to request a particular vaccine is if someone has a severe allergic reaction to one of the mRNA vaccines, in which case the CDC recommends they get a non-mRNA vaccine. So if someone had a first dose of Moderna or Pfizer and had a severe allergic reaction, which we think is to the PEG component, the preservative that's unique to those vaccines, then the recommendation from the CDC is that they don't get the second dose. They have to wait until a different vaccine type comes out, which would be the J&J. And right now, that is the only reason to request a particular vaccine, because we simply don't have enough to be able to pick and choose.
Okay.
The science is also still in development as to whether it's safe to mix and match in terms of do you still get as good of a result in the long run if you got the first dose of Pfizer and then followed it up with a second dose of Moderna. So that's not recommended right now. So it's first and second dose of the same mRNA vaccine or one dose of Johnson & Johnson. The good news is that in trials, all three of those have been exceptionally effective at preventing severe disease and hospitalization. It's a little bit difficult to compare how well they do against preventing mild disease or asymptomatic transmission because you're not exactly comparing apples to apples. They were tested in different countries at different times in the pandemic. We know that different variants of the virus have been circulating during this time and in different countries. So what we know is all three of them work for preventing the disease in most cases, and all three of them work nearly flawlessly in preventing hospitalization. And that's really what we're going for in this first year of vaccine availability. Now, in the future, years out, is this going to be more like the flu vaccine, when every year I have 2, 3, or 4 different options to choose from? Sure, but we have to get there, and we have to survive this year first.
Okay. Very good. Uh, uh, if there's any questions from anyone on the call, feel free to pipe in. Otherwise, I'd like to move into the providers who were trying to register to administer the vaccine. And I don't know what you've heard, Dr. Axelrod, but we haven't had any success there, and I don't know if that's necessarily a bad thing as long as the patient's getting it somewhere. So, what have you heard as far as the workaround? What the providers need to do to, if you've completed the first step and you haven't heard anything back from anyone, is that okay? Should we just wait at this point? Our offices and practices getting the vaccine, or at this point, again, are we just waiting it out and just trying to encourage our patients to register elsewhere?
You know, speaking from a complete lack of any privileged information into how the district is processing these requests, what I have to imagine is that they have a limited number of staff processing a lot of requests, while at the same time trying to fix how the existing vaccine sites and registration system functions, while also not knowing when and how many additional doses are coming. So I would think that it's appropriate to send a gentle reminder saying, hey, we're still interested, but to not be surprised if it takes them a while to get back to you. And in the meantime, if your patients and staff can get shots somewhere else, they should.
Okay. Yeah, we tried to jump on the bandwagon early on, and that kind of left us hanging, not sure what to do, where to go for guidance on that. So I have registered, and we're patiently waiting. But in the meantime, the focus is just fielding the calls, answering questions. We've got a lot of administrative questions, patients calling to see do they need documentation to take with them, will that help? If they have a pre-existing condition, if they have a letter, those kind of things. So it really, you know, has us shift everything that we've been doing right now in a practice and making sure that our staff are as informed as possible to field questions and then turn them over to the, providers if the questions involve a little bit more expertise. But those are the general questions that we've been faced with is, where to go, how to register, do we need documentation, should we type letters for everyone, is that going to help? So again, any insight you have into those things is very helpful right now because we really look to each other for information at this point. We had some feedback that when the additional vaccines came available, or as they do, that the site is, again, very cumbersome. It crashes often. You can try to, patient tries to register and it'll be, in the midst of the process and then it times out and then they try to log back on again. So and as you said, calling on the telephone, I've heard, patients say that they were on hold for up to 2 hours.
Mhm.
I guess if it's worth it in the long run, just to carve out some time, try to get it done any way possible. But if that's what you're hearing that we have to do, then that's good information.
Unfortunately, that is the current situation. It is painful. It is full of glitches.
Yeah.
It's trying to build a superhuman effort on top of a very shaky infrastructure. And
Yeah.
it is expected to get smoother in coming weeks. It's just not an easy or quick fix at any particular point. I do think it's valuable to know that this is happening in every state and every county. We're not unique, unfortunately, except we are in the way that we don't have representation on the federal level the way states do. But we also are looking at a city that's had very uneven, not exactly equitable reach of the vaccine into the communities that have been the hardest hit. So one of the disparities the city is trying to rectify right now is how to make vaccines available to people who can't spend 2 hours refreshing a website or don't have broadband internet with high use of data accessible to them, or have vision problems, or are older and can't navigate registration platforms that are online. So what we hope to see is as more vaccine becomes available, especially the Johnson & Johnson one-shot option, we hope to see walk-up sites or neighborhood registrations, neighborhood vaccination drives. Been having a conversation with some people in my life lately saying if we were trying to solve this the way we do work in global health in international low resource settings, we might consider mobile vaccination drives, vans, community health workers, outreach teams. So there are people at different levels looking at how to bring the vaccine in ways other than a cumbersome online registration portal or needing to already be part of a medical network at a high-end medical practice that's just not accessible to many people. We hope that that will decrease some of the pressure on the registration portals, which will then make them easier to use and less crash prone.
Okay, very good. I have a question related to providers that are hoping to get the vaccine in their office. For those offices that have already been storing other vaccines and have a vaccine thermometer, do you have any insight as far as, is there anything else that needs to be done to prepare? Can a traditional thermometer that's tested regularly sustain the practice if they've got dedicated space for it? Is there anything that the offices should be doing as far as preparation for that coming besides, that we wouldn't ordinarily do?
I think apart from making sure the equipment is up to date, has the appropriate inspection dates on it, and that you're not experiencing problems with your other vaccines. If we were having this conversation a few weeks back, we'd discuss about the special requirements for the Pfizer vaccine. However, Pfizer made additional information about how the stability of their vaccine fares in not super cooled conditions, and it seems that it can be stored under standard freezer and then thawed out and refrigerated for at least days at a time. So there are now updated recommendations for how that vaccine is to be handled. I think that will also help free out more vaccine for distribution in clinics and community pharmacies. But we're really looking at a shifting picture on a week-by-week basis right now.
Okay, thank you. What suggestions do you have for clinics if they're small in size, if they've got, we've got to have a patient sit and be observed for a certain amount of time after the vaccine? What suggestions do you have for flow and handling, the pre-screening when they come in, and just where to put them, who to assign to those kinds of tasks? And what potential issues have you seen post-vaccine, in the immediate time post-vaccine, that a practice would have to be concerned about?
So a couple issues. One is I really can't overstate the importance of good ventilation and making sure you have at least 6 feet between people as they're sitting there for half an hour, and that everyone is required to wear masks while doing so. I assume that people who show up to be vaccinated against COVID-19 are pretty savvy and will want to be wearing their masks, but you never know, right? And some people wear their mask, below the level of their nostrils and may need a gentle nudge to fix it. So we want to be able to do the 15-minute, 30-minute observation period after vaccination safely for all involved. We know that no one is requiring a negative COVID test in order to enter a vaccine site. That would just not be doable from an operational point of view. So we're relying on all the standard safety precautions that we would otherwise require in our waiting rooms, and possibly better than usual because we are asking people to sit there for half an hour. So that's part one. Part two is recognizing that severe allergic reactions to the vaccines are exceptionally rare. We're talking a handful of cases per million. So we're not expecting that people have those severe reactions that require immediate medical attention, but you want to have your staff trained for what to do in case someone starts to develop signs that could be anaphylaxis. And to also do all the usual things you would do if someone were to have a syncopal episode after vaccination or lab draw, right? So some people have a vasovagal episode, basically like a temporary loss of consciousness or needing to lie down or getting dizzy after vaccination. So we want to prepare our staff and not panic, because this is what we do during flu vaccination season every year, or whenever we draw blood or give shots. If it happens after the COVID-19 vaccine, we know that these vaccines are receiving a lot of attention right now. We don't want to create a panic around them if something happens that might happen with any vaccine, just in terms of like staff expectations and education.
Very good. Very good. And I know that we are all feeling a bit of relief that this is happening, and that our practices are starting to be able to open up. And hopefully we're past that panic zone now, and we continue to stay informed and meet the needs of each individual practice and patient population. Does anyone have any questions that I haven't already covered from the list of questions that were submitted? Anything else?
I have a question.
Pauline, please.
Hi, this is, yeah. So patients are asking us if the federal government is supposed to be covering the cost of the vaccine, why are they being asked for health insurance when they go to obtain the vaccine?
Mm-hmm. Well, so one of the possibilities is if people have those rare events after vaccination and do need to be taken by ambulance to a hospital. You really don't want them to end up with the ambulance bill, etc. So that's one possibility.
Okay.
The other, I honestly don't know all the different levels on which information is tracked, but one of the imperatives in how the federal government is collecting data on vaccination and who gets it does involve collecting some information about age, other demographics, getting a sense of who the vaccine is going to. So I imagine that obtaining insurance information at least lets us know something about the people who are getting vaccinated and via some kind of identity verification.
Okay. Thank you.
Any other
By the way, in
questions?
terms of identity verification, one thing I want to mention is there is no requirement for a proof of legal residency or citizenship to get vaccinated. Eligibility for the vaccine is based on medical conditions and employment role alone. It's not anything beyond that. So people who have worries about immigration status should not be afraid to come get vaccinated.
Good to know.
Okay. Dr. Axelrod, I want to thank you for taking time out of your busy day to help us with sharing all of our concerns and answer the questions that really are of great importance to the members. Thank you so much for taking your time today.
Thank you all so much for the work you're doing and for helping us get DC residents and medical workers to a place of safety. I am experiencing in the past year many of these same frustrations in my work and my life as well. I think we really are all in this together and we will break through. I think there's real hope in the next couple of months as the vaccine pipeline and distribution improve. And maybe we'll learn some lessons about how to make these kinds of efforts successful in the long run.